In Australia, an average of 7 men die by suicide every day. 3 times as many men as women have taken their lives in 2021. Despite these harrowing figures, only a quarter of men seek help from a mental health professional if they're experiencing personal or emotional problems. Next week is Men's Health Week, which raises awareness and encourages men to understand the importance of prioritising their health, both mentally and physically. And joining me now to give us some insight into the initiative is Peter Hayton, Chief Psychologist at Banyans Healthcare. Peter, welcome and thank you for your time this afternoon. These statistics, they're really quite devastating. What are some of the reasons men don't seek help when experiencing mental health problems?
Yeah, I think they are very concerning, aren't they? And when we think about those reasons that men don't go and get help, there's a sense of kind of like an awkwardness, I think, still around men and reaching out and getting support. Even talking about mental health, we know that in our world, we have this kind of gender imbalance, and for men, there's this kind of sense of privilege there, and we know that that needs to change. And but there's this kind of sense of I've got to be strong in myself and be the alpha or be in charge or be less emotional, and those kind of issues really prevent men from reaching out and getting support, not just in our mental health, obviously as a psychologist I'm thinking about that, but also our physical health too, and those two are really linked together.
Now, a point that's been raised is the impact exercise has on our mental health. It's reported that 1 in 3 Aussie men aged 18 to 64 don't fulfil the recommended amount of physical activity. Can you tell us what is that amount and what are some of the proven benefits of regular exercise?
Yeah, look, the proven benefits of exercise, particularly in relation to our mental health, we know that there's a symbiotic relationship there. And of course, it goes both ways. When I'm working out or I'm active, that's going to improve my mental health. And also when I'm feeling good about myself, I kind of want to get up and do that. And it's really about the habitual exercise that supports us. The recommended activity, it's around 2.5 to 5 hours, kind of like a moderate activity each week. Or if we're doing something a little bit more intensive, it can be like as low as 1 to 2.5 hours a week. So that's something we could probably achieve as most guys. I know that when I get up in the morning and take my dogs for a walk, and I do that regularly most days of the week, I'm in a much better position to move through the day and be focused on the things that I need to. So that kind of exercise, even low-level walking, really, really healthy for us.
And what about a work-life balance? Post-COVID, the pandemic, we found a lot of people have been working from home, and so without even realising it, they're doing extra hours. How has that impacted the numbers?
Yeah, that's right. I think that, the figures that we're looking at are like 21. And so that's after that really 2020 COVID period. And we're noticing that increase in those suicide rates and those quite shocking figures in 21. I'm hoping that things have gotten a little bit better since then as we've adjusted to a better sense of normality. However, when you look at the data, particularly amongst our young men, we know that there's a lot of distress that they're feeling. And I was talking to a bunch of year 12s just last week, and we were noting how for males, the level of distress that we're reporting in the last 4 to 5 years is in a stronger increase as compared to females and other genders. And, I think dealing with that distress is something that we're not so good at. And getting that work-life balance is so important for us. It's that habitual kind of routine that really helps us.
And what else can we do to tackle this rate and reduce the prevalence?
Yeah, look, I think when we think about other coping mechanisms, we've really got to watch out for what we call maladaptive coping. And that's where we do things that, because we're not feeling well, emotionally well within ourselves, that don't help us. One of the big indicators there is alcohol. For guys, around about 20% we're reporting a really unhealthy relationship with alcohol. And when you think about things like depression and stress, alcohol is really strongly implicated in that. Of course, other drugs and even eating habits that aren't so healthy for us are all things that impact our emotional well-being. And we want to kind of tackle those and reduce the alcohol intake, avoid other drugs, watch out for the medications and take them appropriately. And those kind of things are really going to help us move away from those maladaptive coping mechanisms towards some things that are more adaptive and healthy for us.
Yes, absolutely. Peter, Hayton, thank you so much for your time this afternoon.